and welcome to this week's edition of Enthralling Conversations. Today, I'm very pleased to be interviewing Dr. Kathryn Polovitz, who is a neurologist and epileptologist. So I will start, as I always do, Katie. Who are you, where are you, and what's your professional role in the epilepsy community?
Well, I really appreciate the opportunity to be here this morning. I'm Dr. Kathryn Polovitz. I am an adult epileptologist, so I take care of individuals who are adults. And I'm out here in Colorado in the outskirts of Denver. I practice with a bunch of other neurologists, but I am our epilepsy expert. And my role in the epilepsy community is to take care of individuals who have epilepsy who are in the community.
And what interested you in epilepsy to begin with? How did you choose this as a specialty?
I mean, how could you choose any other specialty? But, I had a very interesting path. When I was in medical school, I thought for certain I was going to be an OBGYN. And when I was doing the different rotations, I realized that I really liked to deliver babies, but I was not a very good OBGYN. And so I didn't quite know what I was going to do. I remember learning neuroanatomy, and I remember thinking it was so difficult, but I think because I thought it was so difficult, it ended up sinking in really well. So when I did a little neurology rotation, I was like, I think I might be a neurologist. And then I had the privilege of, in my fourth year of medical school, doing an epilepsy monitoring unit rotation, where if anybody is new to epilepsy, an epilepsy monitoring unit is where individuals who have events concerning for seizures come into the hospital on a planned basis. And we try to see what their seizures look like and what the options are for their seizures. So I did one of those rotations down at Mayo Clinic, Arizona. I ended up falling in love with everything. I fell in love with reading EEG. I fell in love with working with people with epilepsy. And I really loved the fact that we had many options for individuals with epilepsy and continuing to learn in this field.
Wow, interesting. So, I know today we want to talk about something that you know a lot about, and that's vagus nerve stimulation or VNS therapy. So tell me a little bit about this. We know that in the epilepsy world, probably 30% of all patients that suffer from epilepsy have uncontrolled seizures. And so VNS addresses that. Can you tell us a little bit about VNS therapy and what it does?
Yes, and Laura, you're so right. In epilepsy, about a third of the people, if not a little bit more, have what we call drug-resistant epilepsy. So if you're at home and you're thinking, my medicines aren't getting the job done, I keep having seizures, you're not alone. It's the second most common outcome in epilepsy. So 1 out of every 3 people with epilepsy, so over 1 million people in the United States right now, their medications, which means just 2 medications, if you're still having seizures, it means drug-resistant epilepsy. And so just doing medicine after medicine is not the right choice. It's something you're going to keep doing. You're going to keep working on the medication aspect, but you and your provider should be looking at other options outside of medicine. And the oldest option outside of epilepsy brain surgery is actually a medical device called the vagus nerve stimulator. And the vagus nerve stimulator has been FDA approved since 1997. So it's got a lot of years under its belt. And it's not a brain surgery for epilepsy. It's actually a little computer device here in the chest, if you think about it, kind of like a little pacemaker, with a little wire that goes to this nerve called the vagus nerve. Now, it's so incredibly interesting and amazing to me that the researchers back in the 1990s figured out that this nerve, this vagus nerve, is a massive tattletale or gossip. It brings all the information up to the brain. So essentially, by stimulating that nerve, you can change what's going on in the brain without having to do brain surgery. So it was a miraculous discovery, and over 130,000 people have received this therapy. And it's definitely something I offer to individuals in my clinic who have drug-resistant epilepsy.
And so for a patient that decides to have a VNS device implanted, what does that look like? What does the surgery look like? You said it's not brain surgery, which is great. So it's not as invasive as a brain surgery would be. But what should they expect, and how long would it take to actually see some results?
Great question. So the vagus nerve stimulator surgery is typically done by any surgeon who's really good at this part of the body.
Mhm.
And that includes vascular surgeons. So they're used to these blood vessels over here.
Yeah.
It involves ear, nose, and throat surgeons because they really know this territory. And it involves our neurosurgeons because they are just incredibly good at working on nerves. And so we use all of those in different types of surgeons. And the surgery is actually not very long. It typically is only maybe a couple of hours at maximum. And most individuals, the vast majority of individuals, go in for surgery that day at what's called an outpatient surgery
Right.
center. So it means they're not going to have to stay overnight at the hospital, and they leave that day. So it's what's considered an outpatient procedure. They don't have to stay in the
Right.
hospital, which is an incredible benefit. The recovery time is actually pretty short. The incisions are usually just one little guy here in the neck to getting access to our little tattletale nerve, that vagus nerve. And then one here either in the chest or sometimes from the armpit area to make their way to the chest to put the computer there.
Mhm.
Then they work and connect those two pieces together, but all of that's under the skin. So the recovery is just those little incisions to heal, which is only usually a couple of weeks, if even that. And people should expect to see their surgeon maybe about 2 weeks after surgery. They check those incisions, but then the work really starts. The work starts about 2 weeks after surgery. You'll be hanging out with your provider quite a bit, where we do some programming on the device. So I tell people to expect the device to take some time to work. And that's what we've seen in clinical trial after clinical trial. I actually undersell things. So I make sure to tell people, don't expect much and don't judge it till at least about a year out. Now, I've had many patients make a liar out of me and they have a faster response to the device, but it's really important to have those expectations going in so that if you're expecting, oh, I'm going to get this surgery and 2 weeks later, my seizures are already going to start getting shorter and less severe. It's important to have more realistic expectations.
So, question for you. When I look at information about VNS therapy on the LivaNova website, it says it controls seizures 3 ways:
Yes.
prevention, response, and on demand. So tell me a little bit about each of those. How does it work in those 3 ways?
Yeah. So until 2015, there were 2 ways that it worked. The important thing is there's always the background way that it works, which is called the normal mode. That's you and your provider. We go over to the computer and we program it. And we program it to stimulate this little nerve, say, every 5 minutes for 30 seconds, which only ends up being about 10% of the day. So we put that and it just goes. And it just stimulates. People get really used to that stimulation over time. Sometimes when you're first getting used to the stimulation, it can feel a little tickly, but I have not had anybody in my clinic not be able to tolerate that stimulation where they'd had to get the actual device taken out. We sometimes have to tinker with the settings for tolerability. So we set that one, and that one is just there in the background all the time. Then there's the magnet mode. Now, the magnet is actually incredible. It's a perk. Well, the magnet an individual can wear on their wrist or put on their belt or put on their purse loop, and it delivers on-demand stimulation, meaning you take the magnet if you feel a seizure coming on and you give your little computer an extra swipe. Or if you don't feel it coming on, which is extremely common, other people, if they see you having a seizure, can use the magnet. But if somebody's in my clinic saying, well, I don't know when I have my seizures, it doesn't exclude them from getting the vagus nerve stimulator therapy because there's still that that normal mode constantly happening. Now, in 2015, there was an incredibly great added benefit. What was added was a little monitoring of what the heart rate was doing. And we know heart rate rapidly increases with over 80% of seizures. So it picks up on a rapid heart rate change and delivers an extra stimulation.
Well, that's terrific. I mean, I've learned a ton about VNS therapy today that I didn't know. I've been familiar with it, but didn't realize all of that. especially really interesting to hear the 3 different ways that it works. I wasn't as aware about the magnet piece, which is really interesting. And it sounds like there's continued innovations on the horizon that will continue to make this a better device. This has been really helpful. Dr. Polovitz, thank you so much for talking with me today. If our watchers would like to get more information, they can visit our website and look at VNS Therapy to learn more. Thank you so much, Dr. Polovitz, for being with me today.
Thank you, Laura. It was my pleasure. I appreciate it.